Well, thank you for joining us. And as you know, social media is a big part of our everyday lives. For some people, it's just for entertainment. But for some people, it may turn to social media for work or even to learn something. So however, today we are talking about the impact that social media can have on kids. So joining me today to talk more about this, we have Jessica Knudsen from Clarity Child Guidance Center. Thanks for being here. And also we have Dr. Amy Cobb from University Health, both here to talk to us about the impact of social media. Thank you both for being here.
It's a pleasure. Thank you.
Well, we're going to discuss how to talk with our kids about social media and how to find better ways to balance social media with other activities that might be healthier for our kiddos. So you each have specialties, and I was going to say, Jessica Knudsen, you are the CEO and the president of Clarity Child Guidance Center, and we're going to start with you first. Tell us a little bit about, what you've seen with parents and kiddos so far regarding this topic.
It's hard to summarize because it touches so many aspects in terms of child development. I think one of the biggest things we've seen, though, is social anxiety. I know the pandemic feels like it was a long time ago, but we're seeing a lot of residual side effects of kids that were in kind of a developmental stage of growing their peer group that missed out on a lot of that. They missed out on forming those relationships at a time when your parents are supposed to be not cool and you don't want to hang out with them. They were forced to be at home with them all the time. And so we're seeing that show up in things like school refusal, just difficulty forming relationships with peers. And then I would say secondary, the biggest thing we've seen has been depression related to some of the images that they see on social media.
And absolutely, that's a thing for kiddos now at this age. And also, Dr. Cobb, with University Health, your title here, you're with internal medicine, but also a pediatric specialist at University Health. And I'm sure you've seen some physical effects of social media as well.
Yeah, you have to think about the time that kids are spending on social media. They're not spending it doing other things like sleeping, like getting physical activity. So those can have major impacts on their ability to focus in school and their ability to, maintain a healthy weight. And the other thing I'd bring in is, what they're actually, the content they're seeing online can give them messages that can lead to things like eating disorders and, like she mentioned, depression and anxiety. And of course that has physical effects.
Yes, I was going to say that's a concern for all of us parents, and and so often we talk a little bit about children and social media, but sometimes we don't take the time to stop and look at it from their perspective. So I actually had the chance to speak with a group of students ages 11 to 14 about the platforms that they're drawn to, and they actually shared their honest thoughts. So let's listen into what they had to say. What do you think the best thing is about having access to Roblox or Instagram or YouTube or TikTok, or CapCut? What do you think is the best thing about that?
I think you can get exposed to a lot of new ideas, stuff you never really think about before, and you can talk with your friends and stuff. Because I live very far away from my friends, so I don't get to hang out with them a lot. So it just helps me talk to my friends a lot.
Keeps you guys connected. Okay. Anybody else? Honestly, I think because you can keep in touch with your friends, and also you can find new ideas, and you can or also it just gives out videos and what has happened or something. For Roblox,
really just communicate with your friends, just playing with them. So I like that. It's just fun because it's something you can do when you're bored. If you don't have anything to do, you can just get on, something like that.
And that's part of, you said YouTube that you kind of get on. Is there a best part about that?
Yeah, YouTube or Pinterest. I like Pinterest because when you're bored, you can look at things to do, or if you want to pull an all-nighter, you can look at things to do then. But I don't like pulling. I just like looking at ideas to do during the day.
So there's positive things to look forward to on social media in general. Conversation with the kids, and they were pretty forthcoming when it came to the positive effects of social media. They were ready to talk about that. But we know that with social media, there comes both. So given your clinical experience, are you seeing a decline in face-to-face social skills, and is this affecting children's overall social and health development? And I guess we can start with you, Dr. Cobb.
Yes, I really wanted to react to them saying that it allows them to connect with their friends, and I think that's a common argument. But what is the quality of that interaction? So you have to think about social media. It's often asynchronous, meaning it's not a real-time interaction where you're getting body language and tone and you're feeding off of each other, right? The other thing I would comment on is, when you're trying to fit in with a peer group, which is really the developmental task of preteens and teens, before social media, they had to spend weeks watching other people, gathering information, figuring out how different maybe looks or behaviors, how others reacted to that. But in social media, they can scroll through so many data points so quickly, and they get feedback with those likes and shares about how popular it is, and think about how much impact that can have on a child's mental health. So I don't think it's the same. It does not replace in-person interactions with their peers.
Yeah, absolutely. And the same question to you. I mean, do you think that it's like starting to limit that face-to-face interaction, kids involved with social media?
Definitely. They're kids that are going to come home and get on their device instead of going out and playing basketball or doing some other activity. And I think the other thing they focused on were the positive interactions. Not all interactions on social media are positive. The concept of online bullying and some of those behaviors, a million years ago when I was in elementary school, you got off the bus on Friday afternoon and you got a break if you were in a bullying situation or a negative social interaction, at least till Monday. That doesn't exist anymore because it's 24/7. And so yes, it does increase their ability, but I think you really have to measure the positive versus negative interactions as well.
Definitely. And speaking of that, so going back to the positive benefits of screen time and social media, so some kids, they say that there's building some genuine friendships online, and some of them say that they're actually finding ideas, and when they're on social media, they helps them with maybe school projects or even like their personal style. So is there a way that kids can, is there a balance where kids can still find these things and continue to to be healthy, have a healthier lifestyle?
I'd say absolutely yes. I think you use the word balance, which I think is what it's all about. And I think parents have to be involved from the get-go in that. Parents have to know what apps their kids are on, what social media platforms they have, and finding that trust in terms of how much they get into that space. But they have to know who they're talking to, because things that could look innocent could not be also. And so I think parents have to have those conversations with their kids. And I think it was mentioned in your promo, have those conversations before the device is in their hands and set those frameworks.
Absolutely. And you also, is there a way, in your opinion, also to, try to let kids have the benefits of social media but still keep a healthy lifestyle?
Yeah, I have a couple of ideas. So one would be you could come up with a family digital media kind of plan. I know the American Academy of Pediatrics, the healthychildren.org, has a free plan. You can go in and you can set an agreement. Right? In my household, we have rules about when screens are used and aren't used, and with that, it cuts back on the fighting because it's already very clear, right? You can also have screen-free zones. So, one thing I would say is the dining table. I would advocate to always be screen-free, so we have the opportunity to eat mindfully and to connect with our families. We know that family dinners helps protect, especially teens' mental health. And then the bedrooms, that's another area that I would definitely advocate to be screen-free so that we can get ready for bed. Can we have even a digital Sabbath where there's one day a week where we completely unplug and detox? These are all possible solutions.
All right, and all great ideas, and I'm sure parents are taking notes right now. And we also talked to Rick Edwards, the program director at Clarity Child Guided Center, and he says it is okay for kids to have screen time and to be on social media, but he says this shouldn't be happening all day. So he tells us a simple way to balance screen time is to use what you learn online to do something together offline, making that time more meaningful for everyone. So take a look.
It shouldn't be an end in itself to say, oh, okay, so I spent half my day online learning about something, and it's like, well, what are you doing with it? Well, nothing, I'm just going to keep digging into it. It's like we need to use that as a way to kind of pivot to what's that going to do for school interest or career interest, and then being a part of a larger community that is in real life, so that if there's some volunteer opportunities, or there's places where you can take some of that knowledge and mentor somebody younger than yourself around those same subjects. That's great.
Well, when it does come to social media, kids' moods can really swing. It can lift them up or bring them down. So we actually asked our kid panelists how social media affects their mood, what they think is a good amount of screen time, and what they'd miss without it. So here's what they had to say. Anyone ever feel like a change in your own mood after being on social media for a long time? Hold us up here because y'all are sitting next to each other.
Sometimes on Roblox we play games and they're like obbies, and he always kind of like crashes out, so like he gets mad. I get a little grumpy when I'm on like screen time a lot. So.
Yeah. I think that's pretty common for, I mean, not only students in school, but also adults. It happens to all of us. What do you think is a healthy amount of time to spend on social media each day?
Honestly, I think 2 to 3 hours a day.
I'm saying like 2 to 3 hours, 3 or 4 at least.
Okay.
Like 1.5 or 2 hours.
Yeah, 2 to 3 works.
Okay. Kind of in the same boat. What would you miss most about social media if it was just a big screen-free zone, like all the time?
Hanging out with my friends online, I wouldn't be able to do that.
Yeah, same. And also, you wouldn't really know what would be like happening, and like, cause maybe like could be something happening, and like something happening with your friend and you don't know because you don't have social media. You can't get in touch with them.
Going to be connected with my friends.
Yeah. So that connection, y'all would miss from us. For both of you, we'll start with you, Jessica Knudsen. We heard their opinions. How much screen time do you think is an appropriate screen time number of hours or minutes for a child each day?
You know, it's hard to give a hard and fast number on that because I think there are many, many factors that roll into that. I think if the child's in online school versus traditional school, I think if they've been on a computer all day, that factors into how much time do they spend after school on a device. I am probably more on the restrictive side. I think probably 1 to 2 hours is probably a good window. I know the Academy of Pediatrics has some definite guidelines depending on age, but I think 3 to 4 hours starts to get on that excessive amount of time.
Yeah, I think a striking statistic is we know that teens who spend more than 3 hours a day on social media have double the risk of having symptoms of depression and anxiety, right? So 3 hours or more, we are putting ourselves at risk of more mental health symptoms. So that to me seems like a clear line, but the American Academy of Pediatrics says for children, school-age children above, that no more than 2 hours a day. And that recommendation really is looking at, we want to be doing those other activities like active play to keep that healthy weight and other developmental milestones.
And I imagine this is for, kids as young as 10 to even 16 years old. The same rules would apply. Or I shouldn't say rules, but the same things could happen to them from being on a screen for so long.
Yeah, I would say, I kind of separate social media and screens a little bit. Like, I think developmentally, the social pressure applied from social media is really appropriate for those older adolescents, 16 and above. But for screen time in general, yes, I think these guidelines of no more than 2 hours would start, in elementary school.
And then Jessica?
Just to add on that, I think a 10, 11, 12-year-old developmentally cannot process the fire hose of information that's coming in from a social media platform. They just don't have the ability to understand, and older teens hopefully have developed some of that it's not a real reflection of life. And so they start to aspire to that, and it might not be something that is actually even reality-based.
Well, another question. So this is for you, Dr. Cobb. So one of our KID panelists mentioned that they sometimes feel grumpy when they're online for an extended amount of time. Could you explain the impact that that extended amount, so the social media use, can have on children's physical activity levels?
Well, again, it's a very engaging activity that you can sometimes want to check a social media post and then an hour later you're down that rabbit hole, and that's time kids are not outside playing, gathering in community, meeting neighbors, being physically active. And to touch on that specifically, that outdoor play, right? When we're outdoors, we know that nature downregulates our nervous system and helps us feel more calm. Plus, exercise itself gives those endorphins that are so healthy for us. I also want to touch on vision, if I may. So, when we're doing a lot of work with screens, you're looking quite close, and virtual reality, like the Oculus, is probably the worst offender in this, but it leads to vision problems in children, myopia, where you're going to need glasses because you're not getting that exercise that you get when you look at the cloud and the squirrel and the tree. So that's another physical health, complaint or problem that I see, as well as musculoskeletal stuff. So kids who are coming in with back pain and shoulder and neck pain, and it's from too much time, seated, watching screens.
So you're talking about vision problems, possibly back problems. Any more physical problems that kids can experience by being on a screen too long?
Sleep is probably, we've mentioned this, but I just want to highlight it again. Screens can be so engaging that they're doing that instead of sleeping. And then they also give off blue light. And blue light's that frequency of light that we see in sunrises. So it tells our brains it's time to wake up, right? So you can be taking melatonin gummies and looking at a screen and essentially they're canceling each other out. So we really need that separation from screens at least an hour before bed so that we're able to get that good quality sleep that affects our entire health, right? And then the other thing I would just mention, oh, I'm so sorry, I lost my train of thought.
Oh, it's okay. It's a lot to cover when we're talking about screens, but if it comes out,
I will
I'll
jump back in.
Okay. Well, in the meantime, I have a question for you, Jessica, as well. So during the interview, one of our KID panelists, they expressed how not having screen time or creating screen-free zones could leave them disconnected. So what are some ways that families can handle that pushback when creating screen-free zones?
I'd say that's one of the hardest things as a parent is to set a boundary. And I think it's important to do digitally, as with everything else with your child, in terms of the bedtime and not having in the room and setting those parameters for your kids. I think that the contract is a great idea because it takes the argument out of the equation. If you've agreed that these are the hours you can use it, this is where the device is going to get charged, it's not available from this time to this time, setting that structure, and again, having the conversation before the device is in their hands and setting really clear boundaries helps to just take some of the air out of the argument when it does come up.
It's a good idea to set those parameters before, but well, obviously, if maybe not all the parameters were discussed, it's okay to adjust those rules as they get older.
It's a living, breathing document because it's also going to change as the child gets older.
Yeah, it can really help too to have like an engaging activity to do when we disconnect from the screen. So that might be things like, being physically active with a 1-minute dance party, or with my kids, they really like arts and crafts. So I'll get out like some fun stuff, so that they can do that once they get off the screens, because they're getting that lack of dopamine, and then they're wanting something to stimulate them. And I did remember my thought from before.
Okay.
So what I was going to mention is about not just the blue light from screens, but because of the depression and anxiety symptoms that we see as they're trying to fall asleep, oftentimes even if they're doing everything right, they're starting to have they're hearing those thoughts, right? And the depression and anxiety itself is keeping them awake. So it's so hard when we think about physical versus mental effects, because it's not really that artificial. The mind has physical manifestations in the body and vice versa, so it's also connected.
Absolutely, and that's why we want to take these steps to help our kids feel better overall.
Right.
Overall. Well, also talking about screen time with parents can be very tough. So some of our KID panelists say that they don't even want their parents knowing what they do online, while others say that the conversation hardly ever comes up. Do you feel like phones in general, screen time, do you feel like that's a topic that's hard to talk to your parents about?
just don't want to talk about it with them, like just in general.
Well, I mean, I get it. I mean, for fear of that screen time being taken away, maybe.
Like also, if like something bad happens on something like I play on, they might not like it and they might delete it, and I don't want that.
Not really.
Not really.
It doesn't really come up at all.
You don't really talk about like screen time with stuff. We kind of like for example, we'll just kind of like talk about like our life out of screens. You know what I mean? Yeah.
Well, as you hear, we've gotten a mixed review. Some don't want to talk to their parents, and some said it never comes up, and another said that their family discussions are usually about what goes on outside of what's happening online. So how can families encourage open conversations about screen time? I'll start with you, Jessica.
I think it starts with role modeling and talking to your kids about how you're using screen time and what you're using it for, because it's easy for your kid to assume, and we kind of had a conversation before we jumped on, there was maybe assuming you're on social media when you're using it for work. So I think being very honest with them about what you're using your devices for, and putting it down when you're eating dinner and not taking it into the bedroom, and role modeling all for that is the start of it. So then when you're approaching them, they've seen you kind of walk the walk in terms of how you're monitoring your own social media. I think starting the conversations early is, I can't say that enough, is important. And educating them about some of the dangers that are out there and why you're so concerned about it, because there's a lot of great information and there's a lot of really positive things about being online, but there are also bad actors out there, and we need to educate our child not to click on every link. And not to go down every rabbit hole, because it could end up someplace very different than where they started. It could have started with a very innocent Pinterest board that goes 17 clicks in the wrong direction. So I think that's an important part of that communication, is just educating them. And sometimes it's pulling in other members of your family. If they're not having that connection with you, do they have an aunt or an older cousin or someone that maybe they feel is a little more closer to their age? They might hear that message a little bit differently from them.
That's true. And also, Dr. Cobb, what do you think about how you can encourage those open conversations with kids as well?
I think one question you could ask is, what problems have you seen your friends or other peers at school get into online? And that might be an interesting approach, because if they share something that they saw happen, maybe bullying or sexting or something like that, it allows you to take that and say, well, how can we keep you safe from that, right? And then that could be incorporated into your media plan as well.
That's a good idea as well. I have one more question for both of y'all real quick before we see the next clip. So how can families open conversations with their kids on, and you kind of brought this up a little bit, on the real physical health risk related to social media use? If you want to bring that up, like it could physically make you tired, or it could impair your vision. How would we bring that up to kids?
I think we could just share our own experiences, because I think we as an adults are not immune from this problem, right? And so we can share how we've set limits in our own lives, and like we've said, modeling good behavior. I think that's very impactful for children.
Do you have it?
Yeah, I agree. I think it's just having an open dialogue with them, and sharing statistics with them too of what the research has shown in terms of the impact of sleep deprivation on mood and depression can be impactful too. If the child is at a developmental point, they kind of can understand that information.
Yeah, and maybe even a little bit about the neuroscience of it, right? Like, why are screens so appealing to you? Why do you feel this draw to want to know what everybody's doing on social media? Why does it feel threatening when a parent takes it away? There's a developmental reason for those things, and if they can understand it, then it's not big tech, taking over their brains. They're able to have some agency in it.
And I guess that depends also on the age of the child, I guess,
Sure.
and as they get older, like you said, it's going to change. Everything will change.
Yes.
All right. Well, we're moving on to our next clip. Well, being offline together gives us a chance to connect face to face, and it's a moment to bond as a family. So Program Director Rick Edwards shares one more important tip about why we need to practice what we preach when it comes to screen time.
Parents have to be as willing to engage in that as they are kids. So it's not simply, oh, well, do as I say, not as I do. So I have to be off the device. And it's like, I can't use the excuse, oh, well, my work is so important that I have to be on it all the time. Well, that for that child, that school or that connection, whatever that might be, for them might be just as equally important. So we have to kind of practice what we preach around the idea that if it's no notifications, everybody turns it off, that means mom and dad turn theirs off. If that's a screen-free zone, that means everybody is off the screen, not just the kids.
That's what you were talking about, or well, both of you were talking about earlier. Very important for us, and it can be hard. I think I was talking to you earlier about even me. Before bed, I need to send one more email, and then, my daughter's like, "What are you doing?" And I'm like, "No, this is different." But I guess to set the example, we got to really make an effort to not hide our screen time, but do this maybe not in front of our child, so they don't physically see us on a phone or a tablet, and they'll model that same behavior. But given what Rick Edwards just said, do you have any final thoughts, Jessica, on social media and teens and kids in general?
I think the word you said earlier is where I go back to, is finding that balance, because I don't think it's realistic to say they're never going to be on it or that they can never touch it. But finding that balance of how to educate them about some of the dangers, setting those important parameters, and keeping an open dialogue, and knowing what your kids are doing is a huge part of that as well.
Absolutely. And any key takeaways also, Dr. Cobb?
I would just add that, this is such a complex issue and it can be challenging to engage our kids, but it's vitally important. We've highlighted the risk of depression, anxiety, sleep problems, weight gain, eating disorders. It's so much that we can't afford not to have this conversation. And if they're looking for more support, there's so many good resources out there, including, your kid's pediatrician, commonsense.org, the AP, Clarity. There's so much out there. Get the help you need, because your kids, this is crucial.
Absolutely, I agree. I'm an 11-year-old, and I'm sure all the ages are going through it in some aspect, the younger kids or even teens as well. Well, I thank you, Dr. Amy Cobb and Jessica Knudsen, so much for joining us here for this town hall on social media. And we're hoping that the parents out there can maybe take home just a little something. Maybe they can some takeaways, and that will help them in their everyday lives, so they can balance social media and healthier activities out there. So again, thank you for joining us today. Have a good afternoon.